Our next speaker is a colleague of mine. His name is Dr. Jay Sandys. He's a licensed clinical social worker. And he's going to be talking to us about a healthy workplace culture and how that supports both business performance and employee well-being. Anything you want to say about it?
Yes, I'll say good afternoon, Jay Sandys. How are you?
Very well. Good afternoon.
So Jay is here to tell us how workplaces can do more to support their employees. He's a mental health professional with 29 years of clinical experience and 17 years consulting specifically on the workplace and its role in employee mental health. So please welcome, joining us from New York City, Dr. Jay Sandys.
Thank you so much. Thanks, Mark and David. Thanks everybody for joining. I'm going to talk to you today about the workplace culture specifically and how to make it support mental health and well-being. Excuse me. There's a little bit of overlap with Dr. Fry, but I think that's a good thing because we're very much in agreement and we're both social workers who have a lot of experience with employee assistance programs. So I want to start out and just talk a little bit about why this topic's important, define organizational culture and psychological safety, something that was mentioned already, talk a little bit about some of the barriers people face in terms of getting help, and then dive into how to create a more supportive culture within the workplace. So why is this topic important? As was already said, it's not only good for the individual, but it's also good for the organization. And as far as I'm concerned, the workplace plays a really integral role in our lives. Most people who have mental health issues are employed, and the workplace presents an opportunity to see if somebody is struggling and to offer some intervention and have some resources in order to address that. So to me, there's just it's a critical function of the workplace to improve employee well-being, which also, as it happens, helps improve the bottom line. So they really go well together. I've always believed that. I got into EAP work almost 20 years ago, or more than 20 years ago, and it's always been my view that productivity, profit, and so on, business reasons and humanistic reasons really come together. And it's what I love so much about the employee assistance world. So when we're at the workplace, one of the things we have the opportunity to do, even when people are working remotely, and we saw this during COVID, that we had to pay a little bit different attention to their performance or how we measure their performance and so on. But if we're looking at how they perform, their behavior and their appearance, and if there's any changes in those, then we can identify that there might be a problem and we could be a little bit more proactive. Now, what happens if we don't deal with those things? Some of the problems are anything from absenteeism, productivity issues, turnover, conflict, safety issues, and healthcare expenditures also can be really increased. So workplace mental health issues cost companies billions of dollars in this country every year. In lost productivity, but also in increased healthcare expenditures. So addressing something proactively, dealing with it sooner than later is really something that we're striving for. And as Dr. Fry mentioned, EAPs historically were really reactive. And the thought here is we're always trying to be a little bit more proactive. And some of the things that I've been working on and that others have also been addressing is to address the culture of the organization overall and thus improve the well-being and to prevent suicide risk and to prevent or decrease mental health issues. So we're talking about culture. What are we really talking about? It's the consistent, observable patterns of behavior within an organization. It's how things get done. And it has a big impact in terms of how employees are treated, what resources are offered, how safe employees feel asking for help. And this is another term that came up before, which is psychological safety. When we say psychological safety, what we're talking about is people feeling safe enough to take interpersonal risks, to ask questions, to voice disagreement, to share personal information, to share when they're struggling, to share innovative, perhaps unpopular ideas, without the fear of reprisal or repercussions. And this is something that can be established within an organization. In fact, you can have psychological safety also within a team. And it really is good for business, because if somebody has an issue with how things are done or with the status quo, or they see a problem and they feel okay about voicing it, or they have a new idea or a different way of doing things, you can see how beneficial that can be to the organization so that it can be adaptive. But also, psychological safety allows people to speak up and to not fear being judged so much, and not fear some repercussion or losing their job or something like that. So it's really an important part of my message here, that increasing psychological safety is part of something we want to embed within the culture of the organization, and we all have a part in that. We can all advocate for that. So what are some of the barriers? Some of the stuff that was mentioned already, the biggest one being stigma. Now, this is something that occurs across the country, around the world even. Mental health issues, substance abuse issues are stigmatized. People are treated badly, or are thought to be weak, or have a moral failing or something like that. Physical illness is treated much differently. So this is a big barrier to why a lot of people don't want to share, and why it was so brave of everybody here to be able to share some of their struggles. Some of the other stuff is just lack of awareness. Even though we've been doing this for so long, I've been at so many companies, I still run into people who don't know what an EAP is, or don't know how to access resources, and so on. And to me, that kind of message, it really never stops. There's also, of course, an issue around inadequate resources, and that's maybe a bigger problem than most organizations can deal with. So one thing I think is really critical is normalizing help-seeking behavior. And one of the ways we do it, and we've seen it here today, is by leaders sharing their own struggles. So if a leader shares their struggle, it sets the tone here that it's okay to share, that they're not being harshly judged, that there are no repercussions. It's showing that there's some level of psychological safety. But leaders, if they don't want to share their personal information, can also ask people how they're doing. They can share information about mental health. They can prioritize mental health. And to me, that's the biggest thing a company can do. There's lots of specifics, and I'll get into a few of those, but prioritizing mental health and well-being of the workforce for humanistic and business reasons is the main message here. If they do that, they're going to put resources towards it. They're going to start changing the culture of the organization, and they can really make a big impact there. Another thing that I think is critical is gathering data. So knowing what your employees are looking for. So you could do surveys, you could do focus groups, you could do different ways of gathering information. You can also do data analysis of some of the healthcare expenditures and target interventions based on what issues people are experiencing, what things they're asking for, what areas of parts of the organization that are struggling more than others, and being able to target interventions specifically for those needs can really make a big difference. Another thing that I think is really critical is partnering with your EAP. So this is totally my focus, because I work at an EAP and we also do consulting, but I've seen so often that an organization will have an EAP that's just check the box. They have it, it's separate, they don't want to have anything to do with it. And what I'm saying is partnering with the EAP, speaking with the account executives, bringing them in, really sharing some of the struggles and things they're dealing with makes a huge difference. Promotion of EAP services is ongoing. It never ends. And bringing the EAP in to discuss some of the crises and some of the problems can really be helpful, that together you have a partner that can work with you to come up with solutions. Another thing that I think is critical, and that's been mentioned already, is building community. There's a number of ways to do that, but community is something that is so important for all of our well-being. So building a community within the organization could look like creating an employee resource group around mental health, or as been mentioned before, around DEI, or any other number of areas and specific groups, but empowering people within the organization to advocate for themselves and to ask for policy change or additional services or anything like that can really make a big difference. Also, peer programs. I've run a few of those myself and created those, and they're really helpful because they help to bring people together around a common cause, and have people trained and aware of what mental health issues are, how to identify risk, what to do, what resources are available, how to have conversations. And to me, it makes a huge difference, not just in terms of what they can do directly one-to-one, but overall in the culture of the organization. So we've trained a lot of people around becoming a peer and how to support others. But to me, the real difference is I think the people who are peers themselves benefit. And I think they go out into the organization and start changing the culture to make it a little bit more supportive. Another thing that I'm a big believer in is training managers. This has been around forever. People have been doing it for a long time, but I think it's just a critical thing that I wanted to point out. Training a manager about how to have a difficult conversation, how to pay attention to performance. Some of the things that a manager does, but sometimes they don't do it well. Sometimes they're not meeting regularly with their employees, or they don't know what to do or what to say. So providing some training so people can feel a little bit more comfortable addressing a difficult topic and say, hey, I've noticed you're coming to work late. You're not getting things done on time. There's some performance concern. What's going on? How do I help you? How do I stay present? How do I stay engaged with you? How do I show empathy without judgment? And this is something that's learned. And we want to empower managers at the front line and leaders at all levels to be able to champion this kind of thing and really promote mental well-being, to know what to do in an emergency if somebody's at risk and acutely at risk, but also to get something earlier and be more proactive. Another thing that I didn't mention is setting boundaries. And to me, the overall workplace culture, because it's so critical in terms of how supported people are, if there's boundaries set, and it's something we saw really during COVID, is there a difference between work and not working? There really wasn't during COVID, right? It's really something we saw. Are people called after hours or when they're on vacation? Are people expected to be on call 365, every day of the year? Or is there some policy or cultural support for separation of work and life? And I think that's a critical thing to remember. So I just want to say a healthy workplace, the safe and productive workplace. And so I think that those both come together. I'm a big believer in it. And thanks for letting me speak today. Back to you, David, Mark.